Good morning. The Bloomberg American Health Initiative addresses 5 critical pillars, one of which acknowledges that the teenage years are a crucial time for helping lay the foundation for good health in adulthood. Adolescents face a number of risks that can undermine their healthy futures, including taking up smoking. Although teen smoking in the United States declined by more than 70% between 2000 and 2018, a recent spike in e-cigarette use among youth threatens to undo an entire generation's worth of progress. Today, 5 million kids, more than 1 in 4 high schoolers, use e-cigarettes. When it comes to teen e-cigarette use, we are really facing a public health epidemic. That's why in early September, Bloomberg Philanthropies launched a $160 million initiative to end the youth e-cigarette epidemic. This effort is being led by the Campaign for Tobacco-Free Kids, which is partnering, importantly, with other groups such as parents and community-based organizations. We, along with dozens of national public health groups around the United States, are doing everything we can to persuade the administration to honor its commitment and keep its promise to get all flavored e-cigarettes off the market and to support states and localities to ban all flavored e-cigarettes. I'm really excited to hear from our next speaker, Dr. Joneigh Khaldun, the Chief Medical Executive and Chief Deputy Director for Health for the Michigan Department of Health and Human Services. As the very first state to ban flavored e-cigarettes, Michigan has been spearheading the fight to protect young people from these harmful products. Michigan Governor Gretchen Whitmer, who we've worked closely with on the opioid epidemic, ordered the ban after the state health department correctly said the increase in youth e-cigarette use was a public health emergency. Since Michigan acted in early September, other states, Montana, New York, Oregon, Rhode Island, Washington, have followed suit, along with certain localities like the County of Los Angeles. So I look forward to hearing more from Dr. Khaldun about Michigan's experiences and how its efforts can be a model for other states. So please welcome Dr. Khaldun.
Good morning. My name is Dr. Joneigh Khaldun. I'm a practicing emergency medicine physician. I'm a mother, and I'm the Chief Medical Executive for the state of Michigan, something that's really an honor. As was mentioned, earlier this year, I declared youth use of e-cigarettes a public health emergency, and subsequently, Michigan, under the leadership of Governor Gretchen Whitmer, became the first state to announce a ban on flavored nicotine e-cigarettes. Recently, the mother of one of my children's friends reached out to me, and they were desperate because they'd recently found vaping products in their child's bedroom. And they called me, and they were frantic, and they were upset, and they were just appalled that this had happened to them. Subsequently, their easygoing, brilliant teenager admitted that they were addicted to nicotine, and the family was just appalled that these products had crept into their home without them knowing. As a mother, I expect to be able to send my children to school in an environment that is safe and conducive to learning, and certainly not one where dangerous chemicals are permeating throughout the hallways. I expect that when my child goes into a store, they will not be bombarded by cartoons and insidious advertising, nicotine being marketed under the auspices of names like strawberry milk, cotton candy, and bubblegum. And I expect public health officials to do their job. First and foremost, protecting my children's health and the health of society in general. As public health leaders, we evaluate data regarding health outcomes and risk. We work to understand what could be causing any negative health outcomes, and then we act to mitigate those risks. According to the World Health Organization, A public health emergency is an occurrence or imminent threat of an illness or health condition caused by bioterrorism, epidemic, or pandemic disease. There's absolutely no question that the youth vaping epidemic is a public health emergency. In Michigan, every single county that reported on high school e-cigarette use between 2015 and 2018 saw between a 30% and 118% increase in use. In some counties in Michigan, more than a third of high school students who were surveyed between 2017 and 2018 reported using e-cigarettes in the past month. And across the country, new studies show that an estimated 27% of high school students have used an e-cigarette in the past month. That's 1 out of every 4 high schoolers who risk having their brain chemistry altered and struggling with learning and hyperactivity. 1 in 4 current high schoolers who will be more likely to move on to smoking combustible cigarettes and who will be more likely to struggle with addiction for the rest of their lives. What if 25% of a school was sickened by a foodborne illness? What would we do? We would find out what caused the illness, we would trace it back to its source, and we would recall it. We would remove it from the shelf. And certainly, when we find that a disease or epidemic is spreading like wildfire, as public health leaders, we act. For youth e-cigarette use, the data is overwhelming. We know what the cause is, and it would be irresponsible not to act. These same principles of public health, evaluate, assess, act, they apply regardless of the circumstance and regardless of whose pocket may stand to be lighter because of it. Public health professionals do not choose money over health. That is not our job, and we have to remember that even when we are faced with pressures from powerful people and industries who would want us to think otherwise. What I love about public health is really about people. It's about action. It's about not being afraid to take bold steps, and it's about doing what's right. Acting boldly also doesn't mean acting rashly. It means taking action when we understand the data and have tools available to improve health outcomes. In public health, people's lives are at stake, and failing to act when we understand the data and how to mitigate harm can have severe consequences. In this case, nicotine addiction, a lifetime of substance use disorders, and even death. I'm very proud of public health leaders across the country that have taken a stand on this issue in recent months and are working in their states to address this epidemic. I applaud Bloomberg Philanthropies for their $160 million initiative to fight youth vaping in partnership with the Campaign for Tobacco-Free Kids. I also thank the many public health organizations and medical organizations, the Michigan chapter of the American Academy of Pediatrics, the Michigan State Medical Society, and many others who have supported the state of Michigan as we work to address this epidemic. And I truly hope that the FDA will act soon to appropriately regulate these products and keep them out of the hands of our youth. Together, we can do what it takes to protect our nation's children. And if we place more value on business interests than health, particularly the health of our youth, what does that say about us as a society? My charge to all of you in this room is to not be afraid to stand your ground. Speak out when you know facts, and do not let your principles be clouded by political pressures and industry. Remember, we have the noblest of jobs in public health, to protect the public's health, safety, and welfare. It's an honor to be with all of you here today, and it's an honor to serve the great people of the state of Michigan. Thank you.